Hi there. My name is Kelly Redman. I'm a licensed clinical social worker, therapist, and owner of Seven Seas Counseling. And I want to start off by saying I know as a medical provider that you don't have a lot of time, so thank you for taking a few minutes to watch this video to see how my therapy practice could potentially benefit your patients with chronic pain. So, as a therapist, chronic pain is one of my biggest specialties. I spend a lot of my continuing education hours throughout the year going to conferences on chronic pain, doing trainings on mindfulness based psychotherapy, and keeping up to date on the opioid epidemic, how that is impacting pain clinics, and how that's impacting the patients as well. And I understand right now that being a doctor is really difficult when dealing with chronic pain and the prescribing of opioids. And sometimes it can feel like you just don't have enough support, maybe that you would like for the patient that you're prescribing to. And maybe therapy could be a place where that screening could happen for abuse and other potential red flags could be managed. I also want to recognize that this is a really difficult population to work with because we are helping people, and we all got in this profession because we want to help. We're helping people who are in so much pain. And for some people, we can help them find the right treatments and get better and minimize the pain. And for some people, there's just a certain level of pain that they're in, and it can feel oftentimes hopeless when you've tried all these different treatments and nothing's working. And so that's where I find that therapy can also come in and really be a support for that person who is trying to process all of this new information and changes within their body and the levels of pain that they're experiencing. And it's my goal as a therapist to provide support and psychoeducation to not only patients that are taking opioids, but for people that are using other modalities of treatment, because there's a lot of grief associated with having chronic illness and losing some of your identity, and roles in relationships that are changing. And with doctors, your appointments sometimes are restricted to 20 minutes, and I know that you don't have the time to really dive deep into those issues with patients. And so therapy can be a great supplemental treatment to the treatment that they're getting at the pain clinic. And it's my goal in my therapy sessions and using evidence-based practices like cognitive behavior therapy, acceptance and commitment therapy, and mindfulness-based cognitive therapy to help empower the patient and help them feel like they have a little bit of control back and reclaiming their quality of life. And I want to help them shift their focus from getting rid of the pain to how can I live my best pain? How can I live my best life in this level of pain? Because that can be a hard transition in mindset. And we know that some of the biggest symptoms in chronic pain are depression and anxiety. And I find in my work that once we can manage the depression and anxiety and find coping skills for those, that it helps patients to get to a better baseline of pain and reduces their flares, which is really helpful for them and giving them tools that actually work to control their pain through relaxation, or just changing the way that they're looking at life. So I'm excited to work with you in the future. I'm happy to do any follow-up phone calls or video conferences to answer any questions. And I also do a 30-minute free consultation for any potential patient to see if they're going to be a good fit in my practice, because I want to make sure that that person is getting the best possible treatment that they need. So thank you so much for taking the time to watch this, and I hope to talk to you soon.